That's
I'll come back. We'll do it.
with the
Just-
home and
yeah,
some
tell us
extra
what supplies
support
you need.
on the
Okay,
bottom, higher,
so we
that's
can,
it.
okay.
That's what Susie thinks.
Where's the biggest bolster for under the knees? We can start with this just for demo.
Do we have a bigger one than this one?
That might be
Okay.
okay.
So, and I'm gonna demo communication too, just the way I would with a
It's not a
client.
big room.
So, okay, Christy, let me just have you raise your knees for me a little bit, please. Does it go under this squishy? Okay. All right. Now, normally what I would do, I have the big round bolster that's like a, what is it, 8-inch or something? Yeah, but I use that under the knees, and then I'll do a regular pillow under the lower leg. So she's like fully up and then like plateau.
And that take the pressure off?
Yeah, it helps with blood flow, it helps with joints, and then it also makes it nice to work the feet. They're kind of lifted up. But from this position, can y'all see how I can like really reach a lot of things through symmetry? We can also do a lot of the relaxation stuff, right? We can work face, neck, head. Now when I work the neck, don't be afraid to squish the pillow down and get under there. Okay, I've taught a lot of people where they're like doing this, and I'm like, girl, get in there. Now, are you okay with me using this on your neck and shoulders?
Yeah.
Okay, it's paraffin based, that's,
It smells good.
oh, I should have been warming this up. Better late than never.
Yeah, we have something similar, it's like arnica based. It's a little, I'll let you smell it. It's that way, but without the CBD.
So once I kind of warm this up in my hands, take a big whiff. Get more of a bouquet there. So we're not doing a full body work session. Somebody be my assistant there. What's some of those muscle groups at the top there?
I can read my glasses.
The lats, the QL, TFL, abdominal sheath, diaphragm, psoas, iliacus.
Okay, all the back stuff. Alright.
We have masseters in there.
So I'll just kind of, thank you. Your name, please?
Melanie.
Melanie, thank you, Melanie. Okay, from this angle, we can really get into suboccipitals. Important muscles to make sure we hit from this angle, masseter temporalis. Anybody familiar with the connection between the masseter and the temporalis and the pelvic floor? They're connected, isn't that amazing? When we release one, the other responds. And one thing that you'll see, especially I think with first-time mamas, at least in my experience, is a little bit more of that heightened nervous system stuff. So if you were planning on giving them nice, lovely zhuzh up here anyway, just make sure you hit the jaw and hit the temporalis in a way that it doesn't feel therapeutic, like you're targeting it, but you're working it in. But for mamas where maybe they were telling you about their goals, this is a great time to do even more around the jaw, the neck, the face. I like to do compressions here, as long as mama's not lactating. And notice my fingers are not in the personal zone. I'm kind of just using the heel of the hand. And sometimes I'll do this with a single. Just some nice grounding moves. And you guys will all have to make these decisions yourself. If it's a first-time client, maybe just get a sense of what kinds of moves, where are their personal zones. But when you get to that point where you start to really have that fostered rapport and trust with your clients, you can start doing things like maybe they haven't experienced some lovely compressions around the tops of the pecs right under the clavicle there. That could be nice and grounding. Other areas to make sure you target from supine, the anterior side. Quad attachments, right? They're always tight on everybody, but I want to show you guys my hand positions for this. Just make sure you get eyes on this. It's a very, very sensitive, highly, highly sensitive spot during pregnancy, especially after she starts to show, which is usually like week 18-ish, or somewhere in that ballpark, where the bump kind of starts to show. After that starts to happen, you can anticipate a lot of excessive lordotic curve or the ducktail. You might sometimes see that APT, anterior pelvic tilt, doing its thing. But keep in mind that entire pelvis is moving parts. It's not one big thing, right? It's not even two big things. It's actually kind of way more than that. Even the sacrum has lots of little moving parts to it. So the more familiar y'all can get with working the pelvis, it's all downhill from there. Okay. So pelvis, of course, we include thigh, and of course lumbar is part of that. But I like to start up here, hand. Now, right here is that ilium. Okay, so my hand is just, like my fingers can touch the TFL.
Mhm.
But my hand, the palm, is kind of right on top of where that origin site is. I'm also a fan technique-wise of something that I've called compression. It's a compression with just a tiny bit of vibration. Vibration, you guys, is great for working with nervous systems, but compression is also, so they just kind of go together. But I'll start with like origin and insertion, kind of playing around with both, keeping in mind what's happening with the sacrum as I'm pressing on the anterior side. Worked with a mama this morning where every time I did something over here, she had pain over there. So just be real hyper aware. If you need to stabilize here while you work here, again, it's all about making it work. But I like starting in here, fingers facing out, but then I'll kind of rock and roll. And this is not me massaging, this is me assessing. I'm seeing, I'm feeling, and I'm just kind of like, okay, what's going on with the quads? Are we trying to go right here? We need to target. And that's
this oversheet.
always.
That feels nice though.
I always start over the sheet and over the covers. I call this the hello. Like, I'm just saying hello. Again, nervous system. The nervous system is like, oh, hi, nice to meet you. Okay, we can be friends. Okay, and then I'll just kind of keep working down. You always want to pay special attention to the joints. Working around the knee. So if you have any great moves for working around the knee, break them out. I just like to do a little petrissage just right above and sort of right below. And then down here I'll kind of just, what they rename this, the fibularis or whatever, it's peroneals.
They renamed it.
Yeah, peroneals though. So I'll kind of palpate what's going on laterally. Now, why would this be so important to assess in a prenatal client? What's going on with the legs from the hip, starting at where it inserts there?
Supporting the weight of
Yeah,
everything.
the legs are
Yeah,
carrying more.
everything.
Yes, yes, yes.
And it can,
Also seeing if there's any swelling.
Yeah.
I guess
Mhm.
the blood pressure's elevated.
Yes, very good. Okay. Anything else you guys can imagine, think of why the legs would be?
Seeing the mobility.
Yeah, hypermobility, how that kicks in. All of the above, you guys. Great, great answers. Yeah, there was really no wrong answer there. It's all really correct. You're palpating for all of the things, and it depends when you're pregnant week to week, especially in the third try, the last like 6 weeks to a month leading up to the birth is when the relaxin and some of those other hormones really start to spike. So you start to feel way more what I call wobbly pelvis. And you can advise things like belly bands or curb walking or different mobility exercises. So did you mention modalities earlier? I think it was you that asked about modalities. If you get into this world and you want to kind of, okay, what else? The world of birth prep body work, very cool. Lots to get into in terms of recommended exercises and activities mama can do at home. And I'm going to show you all how I would do the left side.
what did you say it was? Birth prep, what?
Body work.
Birth prep. But what I want you all to consider is this is going to be highly innervated. Okay, so the way that you would approach the top of the quad with a non-natal, normally I would just kind of like start gliding and doing my thing and yada yada yada. With prenatal, again, and keeping in mind a trauma-informed approach, anytime I put my hands on, I'm going to like just slowly sink in. Just introduce, introduce, introduce. But it's like when you walk up to somebody's house, you don't just walk in the door, right? That's the first thing you do when you knock. And then what do you do after you knock? Do you go on in?
You wait.
You wait. And what are you waiting for? Say hello, get an invitation. When you're thinking about that, we're always waiting. We're knocking. Okay, hi. Okay, it says hi back. Okay, can I come in? Yes, okay. We're always tuning in on that deep level. And that's a huge component, I think, with trauma-informed work. It's just that extra level of attunement. Okay, so ASIS, we know how to find the quad attachments, yes? Does anybody want me to review finding the quad attachments? Raise your hand up or else I'm not gonna do it. Sarah, you good on quad attachments? Okay, I will say if we had to taxonomize or classify all the different tools that we have, I would say flat and bony. So I like to start with a flat tool, not elbow, but soft squishy part. Soft squishy part, roll up and kind of sink in to that. Now imagine she's got a big old bump. You're gonna have to kind of scoop under the bump and then slowly sink in to the fascia. And then I kind of scoop out and then rock and roll. But again, keeping in mind, highly innervated area. So the adductors on the inner thigh, we don't need to necessarily do figure 4 leg or frog leg, whatever you'll call it, and go to town on the adductors. That can actually be a bit much considering the pubic symphysis and everything going on in the inguinal region. So as far as repositioning legs, I would steer clear from that, okay? But you can do really fun things, like I can still get the adductors this way. It's almost like a pincher compression, but it's not, it's like a rock. But does that kind of move make sense? Is that tracking?
The compression and rocking feels very nice. Actually,
Thank you for that.
my clients would love that.
And then everything down here, the calves, the lower extremities, are considered a cautionary site. Yeah, more risk of DVTs and just, you can do light work, clot steeping. Okay, just making sure. So yeah, you get a lot of, I've been having calf cramps and da da da. Very, very common in pregnancy. I always will educate clients a little bit. Yeah, it's a cautionary site, but I can zhuzh it up. I can do some stretching on the lateral side. I can get the feet. But you'll want to stretch that Achilles every day. And if it's really bad, you'll want to do a ball on the sole of your foot. And you can kind of coach your clients as far as their self-care. But as far as you going to town on their gastrocs, not a good idea. Okay. Any other questions about the anterior side of the body? We're gonna do belly. Are you okay with that?
Yeah.
Okay.
I don't have do your best.
You have a belly. There's no baby in it.
No baby in it.
As long as you consent to that. You're okay.
Can you do like lymphatic on the legs if they have blood clots? No, right? A lot of swelling happens there, so you think you want to kind of move it, but
You know, if they have blood clots, their doctor might have some thoughts about how you need to work on that. And I would talk to that mama about when did she experience that, what are the protocols that she's been doing to manage it. Is it best to just not
They
work
probably
below
know,
the
right?
knees? Yeah. So this is a personal philosophy, but tell me how you guys all feel about this. But I feel like my clients are the experts in their body and their condition, right? So I don't have to have answers. They're the ones living in their body, right? So you ask them, like, okay, tell me more about that condition. How have you been managing it? Have you tried anything that's been working for you? What hasn't been working for you? Get curious, right? Again, not intuition, empathy. Get curious. All right, and this is how I would communicate to a client who's never had her belly worked on, totally new to it. But let's say that you're at like 20 weeks pregnant, you've just started to show, and you haven't been having any pain per se, except maybe some low back pain, but you're curious about belly massage and you're open to it. So we're gonna give you a nice little easy intro. So all I need you to do is hold this up your shoulders like that, okay? And keep a really good grip there, you got a good pinch. All right, in the meantime, I'm gonna undrape. That's how we get that done. Perfect. And I always add, thank you for letting me work on your belly today. And I'm just gonna roll the thing under. If mama has large breasts, I will actually tuck under the breast tissue, but I try to get high up by the xiphoid, okay? And as far as tucking and draping and all of that, just keeping it real, I leave it as loose as that. Because a lot of the time, especially later on, you're gonna be working under the bump quite a bit, and you don't wanna, where's my product?
In the
Oh! Bless you. And now it's gonna be nice. Oh yeah. That's the right amount of goopy. Okay, so who has never done a belly massage or doesn't feel super confident about belly massage? You might wanna, those that wanna get
I like doing
close on the belly.
I want my not pregnant.
I do.
Huh?
I'm gonna go massage and on.
Yeah, yeah. Well, we're about to. Okay, so as I always like to say, I like to start with heart. Start with the heart. This is an upside down heart. But then we work clockwise. This is just putting the product on the skin, nothing special. Except you are introducing your touch, so of course, you know, intentionality goes a long way.
Feel the baby just all the time. It's
Small
belly
belly
mapping.
mapping.
I like doing belly
Yes, me
massage.
too.
So much fun feeling the baby. Here it comes. My glass is greasy.
No, my husband's fixed.
How many do you have?
2 boys.
Boys.
Enough.
So diaphragmatic or diaphragm release, guys. With a baby in here, you can still do a diaphragmatic release, but one of the things with working the belly I want you all to be very, very cautious of is rib hypermobility, okay? You get a lot of rib flares. So just be sure when you're working around the ribs, I always, can you see that? I always have a supporting hand and they kind of work together. For a diaphragm release, I'm also working faster than I normally would because I'm demoing. But with this, I would guide mama and say, okay, I'm gonna follow your breath. And especially on that big exhale is when you can go in a little deeper. You can travel to the next little yummy spot. Well, the diaphragm release doesn't have to be as targeted and intense as you would do it on a non-natal. When the abdomen starts to grow, the fascia stretches out, right? So it actually is already stretched out, so you don't need to apply quite as much to really have mama feel a shift. The other thing is so much of the little fascial releases that are going to happen in this region, we may not be able to feel, but mama may be able to feel. So what I really like to do is after I work, let's just say I've worked this left side here for a minute or two, I'll check in and I'll say, okay, it's time to check in. How are we feeling right versus left? Do you feel anything shifting or traveling? I'll kind of, travel is a word I like to use when I'm doing fascial release. And that also, from a nervous system perspective, allowing mama to check in with her body encourages good interoception. We all know what proprioception is, right?
Remind me.
Sure, so great. Okay, proprioception is basically rewiring what your body is doing through kinesthetic movement and your brain understanding that. So basically, the mom brain, pregnancy brain, momnesia, whatever you want to call it, proprioception can become fuzzy. How you move through space can be affected. All kinds of things can be affected with proprioception. But basically, people who have amazing proprioception are like dancers. Like they just know, their mind knows what their body is doing and they know how to be graceful in space.
They know what's around them.
Yes, and they have excellent muscle memory, and it's almost like autopilot when those functions are really, really working. Interoception, instead of the brain interpreting the body's use of space, it's what's going on inside the body. So when you prompt mama and you say, okay, check in with your body, how are we feeling right versus left, whether it's pelvic check or belly check or whatever, that's gonna make her, how I'm doing? And that's gonna help her.
Most people don't think about it. Like, no, I'm pregnant anyway. How am I actually feeling?
Yeah. So these little moments of opportunity to kind of encourage mama to, how am I feeling? Or, oh, that did release a little bit. Now it's wrapped around to the front. So I know, okay, what I just released posteriorly, now I can hook around to this right hip or whatever. Okay. So that's that. Let's say that she feels good, and I swoop around to the other side, do the same on that side. Do I have your consent to do a little bit releasing down here? Okay. So at the hip bone here, I'm gonna start. Now I'm using the blade of the hand, okay? What I consider flat tool, but it's a tiny flat tool. It's a targeting flat tool. So you're gonna find the bony landmark, wait for her big exhale, and on the exhale you can apply a little more pressure. Really, really important when you're working around the belly, especially the lower belly. We don't want to do anything ischemic. So I don't know how much y'all can actually see with my hands, but I'm gliding in, and then I'm doing what I call a dynamic compression. So it's not a straight compression, it's kind of like a pulse. And they've done some research with living fascial tissues as opposed to like cadaver tissue, where they realize this dynamic approach is kind of like the new way fascial work is going. So working with living fascial tissues, sometimes a little bit of a pulse.
And is that kind of waking up the lymph too?
I mean, lymph is everywhere, as you know, so everything. I wouldn't say it's draining it necessarily, but it's everywhere. Okay. Now the inguinal ligaments are going to be a little bit more medial and a little closer to the groin generally. Once in a while you'll get a mama. It's always a good idea to have her point indicate where she's feeling it. If it's a little bit more out here or even radiating down the thigh, this tends to be the referral zone for round ligament pain. Now there's other uterine ligaments too, but the round ligament is kind of the usual suspect that's why round ligament pain, you hear that kind of commonly.
It's the worst.
You experienced a lot of that?
The second I turned 14 weeks, game over.
14 weeks. Did you have people working on your belly through it? No? Nobody?
Girl, that's a whole story.
Okay.
Yeah.
That's a parking lot conversation. Okay.
Yeah.
And the round ligament, I think I'm remembering this correctly, it goes from 4 centimeters up to 14 centimeters throughout the course. So that extreme stretching of, not as opposed to the broad ligament, which is what it sounds like, it's broader and thinner. And it's kind of this bigger ligament. But the round ligament is like a tiny little, strand. It's very, very targeted. So it creates a lot of pulling, and it's easier to tell when that thing is tight. But you start working on that, you're going to be hitting the round ligament, you're going to be working all of it, because fascia, it's all in the network. Okay. But like this, and sometimes when I'm here and I can even get to the psoas, I'll slightly mobilize the thigh just passively. And you can also, if mama is higher energy or tense, you can kind of jostle the thigh, you can kind of work with her on breathing. But these two things work together really, really well to target about as deep into the pelvic bowl as we can go within our scope on the anterior side. But that kind of work. And again, I'm not,
When working the belly, if they're further along, I don't know if this would be like in massage practice or more like hospital, but massages for breached babies.
Breech release is quite advanced, and I would want to come back and we can talk about that later. Great question, and I do have some moves, but that, again, those are
more
today's kind of a fundamental intro. But yeah, breech release is fun, but I do a lot of myofascial release, but it's not about balancing as much as it's about facilitating fetal repositioning.
That's why I wasn't sure if it was only like hospital settings, because the baby can flip up until the very last moment, but I didn't
And
know
then flip back. A lot of 360 kids.
Yes, they can. So that's why I wasn't sure like if massage therapists ever do offer that, or if it's mainly just like if doulas, midwives help like during the labor process.
Okay, we have a question about turning a baby, flipping a baby who's either breech. Do y'all know about breech positioning?
Yes.
Okay, what is breech positioning?
When they're not head down.
When they're not head down. Excellent answer. So head down is ideal positioning. Ideally, we want what's called LOA, left occiput anterior.
My third was like that.
LOA?
Well,
Oh.
Sideways, completely sideways.
Oh, transverse?
Yeah,
So there's all kinds of fetal positionings. Y'all can look it up. There's lots of nurse websites that give you lots of great infographics talking about all of that. But it's great if you can look at a view. What would this be? Cutting it this way. I can't remember. No, this is sagittal. What's the plane where you cut them in half?
Transverse.
Thank you. So like looking into the pelvic bowl from bird's eye view, right? And they show you baby's head, like how it can present and all of those different things. The reason, so there's a major organization that I don't want to say certified through. I'm an aware practitioner with spinning babies. So spinning babies gets their name from this natural rotation that takes place inside the birth canal, ideally, right?
Ideally.
So that's why it's cool. Once you start to get into this world and learn more lingo, you're like, okay, da 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 da, and that can affect how you can work with the abdomen. Okay, for today I was kind of like, let's do like introductory baby step. Yeah.
I was just curious.
It's so fun. It's incredible work. Yes, we'll talk more because it's great. And there are people, like I mentioned, Jane Mimosay. She teaches a breech release workshop. It's like 3 days. It is a whole thing. People that specialize in breech release. So if you have a breech baby, you're basically looking at what the medical community kind of tends to push you into is either an induction with, C-section with or without induction, or the other one that I've seen is the ECV. So an ECV is called an external cephalic version. And does anybody know what that is? Okay. External, meaning working from the outside of the body. Cephalic, meaning head. Version, meaning change. So it's basically OBs and midwives are the only people that can do this in scope, but they, from the outside, reposition baby. It is a forced, often painful thing. However, we can help. If we have a client who we know has this on the books, let's do a whole lot of myofascial release and let's just give them some inversion positions. Who knows what an inversion position is, by the way? It's basically downward facing dog. Think of it as when your head is beneath your core, your torso. So like Batman sleeping upside down, that's a full inversion. But for birth prep work, especially with a fetus that's not head down, there's a lot of different moves. One of them is that move. Anyway, I'm gonna stop because again, this is like a whole other world, but it's fun to get into. But belly work, our goal should not always be perfect symmetry if there is some kind of fetal positioning where maybe it's strategic to release one side, leave the other side tense. Does that make sense? Okay. So shallow end of the pool, if mama just wants a nice intro, I might just do what I just did and like leave it at that. Because again, I'm thinking about her nervous system. I want her nervous system to be friends with these, right? I want that to be a comfort. And sometimes it's nice to introduce before we get into the deeper stuff. What happens commonly working the belly too is like it's an emotional center, right? There's a lot that we carry in our belly, and we don't often, even our intimate partners won't sometimes touch our belly. It's just a part of our body. For a lot of us, it's a personal zone, right?
And clockwise is still important
Yeah,
for direct distraction.
yeah. It has to do with the guts.
Yeah.
You just want to go clockwise. I mean, I've had a teacher make a bad joke about if you go in reverse, it'll constipate. No. But generally speaking, if we're trying to work with the direction of the intestines, yeah. And with babies, with baby massage, you always do a little clot work. And the I love you, and just push it down. Okay, any questions about anything we've done with the anterior so far? Okay, what's happening next, by the way, too, I'm demoing all this stuff, and then we're gonna have breakouts. You guys are each gonna pair up, go to a room, we're gonna round robin it. So I'm gonna be jumping around, kind of helping guide you guys, but that's what's coming next, just to give you a heads up. Okay, so let's say that we're doing a 60. I probably would only have time for this and left laning, or left side lane. Okay, so if you have to pick a side, pick a left. Now during the intake, because I'm very detailed and I've got my intake process, I will even ask Mama before we begin the session, do you think you'll want help getting off the table today? That's one question that I ask. The other question that I ask is, I'll kind of explain what we're gonna do in session. I'll say, okay, I'm gonna start you off this way, then I'm gonna have you roll onto your side, I'll guide you through it. Is it gonna be a thing if we end with one-sided work? Are you the kind of person that really likes symmetry? And I ask that because there are clients who don't feel like a session is complete if it ends one-sided. So at least me introducing that question during the intake shows her that I'm thinking about her needs, that specifically. I think that's a good thing. But most of the time when I ask that question, they're like, they don't care less. They're just like, yeah, no, that's fine. Like, I just want to make sure that my goals are reached. Okay, but I think personally, I think it's a good thing to ask.
Yeah, so you might feel left undone.
Yeah. Yeah, and honestly, when I'm a client, I like symmetry too. So
Yeah, I'm gonna be like, I'm on both sides.
all right. So, for the purposes of this demo, I'm gonna have you roll Marilyn. But this is how I do it. This is how I'm gonna have her reposition. Okay. No, I will just leave that because we might be doing belly on your side. I might want to demo that. If you did want to remove that, I would ask Mama to remove it herself.
Remove what?
The breast cover,
Okay.
pillowcase. Yeah, and don't be shy about asking your clients for their help. I also, anytime I need to move a bolster, can you please raise your knees for me? It's a partnership.
Yeah.
Okay, so we'll just leave that on you for now and go ahead and turn. Can you swoop around that way, Sarah? Okay. Perfect. And then I'm going to remove this one and have you scoot down just a little bit. So she's on one of the pillows. Actually, I'm going to take this one away too. Let's replace this one. Let's see how that one feels for you. How's that feeling? Would you like additional support?
Feels like that's up high, too high. I prefer it to be more flat.
Let's have you scoot down towards your feet just a tiny bit more.
I'm on top of the bolster.
That's okay. We're going to move the bolster in a second. That's good. Okay. And then May give you this to cuddle.
Okay.
Can you show the heart pressure on the side like that?
Say that again.
Can you show us the heart pressure, like to put it on right now? Not the soft,
The hard
the
pressure.
hard part.
The hard
Like
pressure,
pressure,
yes. When
pressure.
I work around her
Yes.
hips and glutes and legs, we
Mhm.
can get into more of the deep tissue.
Okay.
Yes, yes. As far as draping the legs, is there another regular size pillow down there?
Yeah.
Oops, sorry.
Purchase.
Crush it.
swing it across. Just, you can turn that off and just get rid of your phone.
Yeah. Okay. So I'm actually going to use the bigger one. I'm going to sneak this to you, just have you raise that knee. Okay. So what kinds of things am I looking for after I reset the seat? That was a real question. What kinds of things am I looking for after I reset the seat?
She's comfortable.
Sure. Are you comfortable?
I am.
Okay, we've checked that.
I
What else am I looking
personally look to see if they're leaning forward more with like their shoulders and just
Like if
upper
she's
body.
rolling for instead of like
Yeah.
stacked. Okay. Yeah. So the main thing we want to look for is skeletal alignment and oral. She's stacked basically. No need to be totally crazy anal about it, but basically, I kind of tend to let Mama do what she wants to do with her upper body. There's different preferences that you'll see. Some mamas want like a big wubby and they want to like. Other mamas are kind of just higher energy and they want the freedom to be free. That's a nervous system thing too, and you want to like allow that. Like a kid at recess, right? You don't want to restrain it, let him move. So the place I usually tend to start is at the pelvis. And I will start exactly where I'm standing here. Notice I'm kind of in line with her thigh. Okay. But I'm going to stabilize. And then this heel of the hand is right at her TFL. Starting in slow, little contractions, and I'm assessing. One of my other practice principles is that pressure requires counter pressure. So, can y'all see? He's getting a good view of my tuchus from back there. No, I mean you can if you want to. I just want you to be seeing the good stuff here. All right, so we've got the femur inserting at the acetabulum. Yes, yes. So that's a big joint to go all around. And some people like that crisscross move. I personally am not a fan, but you can get under the scap and right at the top of the hip and do your crisscross move. But again, before I even start to dive in, really, I'm assessing. So I'm feeling the mobility of the joint. Down here, I'm going to be hitting the ischium. And I'm kind of just doing a pincher compression. If y'all can see that, but just assessing. Now to work the actual leg and thigh, I like to swoop around the anterior side also because I can kind of see how she's doing. But I like this angle because I can feel the heels of my hand are on either side of the IT band. I don't know about y'all, but I hate working directly on the IT. I'm kind of like, don't do it. Like I always taught my students, go adjacent or work the TFL. I find that if you release the TFL, oftentimes the IT kind of follows suit. So that's a little hack for you. But working the IT is kind of just gonna make stuff angry. Certainly doesn't help the nervous system. But how do these little squeezies feel? They feel great. Okay, let me show you guys my pressure check too. I use a 1 to 5 scale for pressure. I like to start with whole numbers. 5 is going to be ow, stop now. It's your pain threshold. 4 is that nice, I think it's nice, hurt so good kind of feeling that we want when we're targeting. 3 is a nice medium firm. 2 is light, 1 is nerve touch. So we'll start with those whole numbers and we can get more granular as we go. But using that 1 to 5 scale, how would you gauge this current pressure?
A 3.
A 3. And what would be ideal for you right now?
A 4.
A 4. Okay, tell me when I'm there.
Yeah.
Okay. So that little back and forth process very quickly got me exactly on the page she wanted me to be at. Okay, let's go more granular now. Cool? All right. So Chrissy, where is my pressure currently at?
You like at a 3.
At a 3. Okay, and what would be ideal? Give me a specific.
That's nice, actually, what you're doing right there. That's good.
Okay. And
Good pressure.
what number am I at again? 3?
Yeah, 3.
Okay. Can we imagine that like 3.2 is your ideal? Okay, tell me when I'm there.
You're there.
Okay. So yeah, you can get kind of specific with it. Okay. Now as far as draping, because I know you guys want to see that. This is my, I apologize, and yet I'm not sorry because it works. The important thing, in my opinion, safety, right? So if there's a top blankie, I gather it behind the tuchus. And with the top sheet, I'm not gonna do the crisscross applesauce drape. Have you guys seen this where they wrap it around the leg? Girl, I hate that. I just really, it's just mussing and fussing with a leg. Her goal is to relax and escape, and I'm not about, let me do all the things with your leg. Let me just let you lay there and enjoy, and I'll just do my thing. So here's what I do. If you guys need to swoop around to see, feel free to come around. But I'm going to create a tuck under here, a loose tuck here, and then that gives me freedom to move about and actually massage. Does that make sense to everyone? Okay. Anybody else want to swoop around and get eyes on what I'm doing?
Okay, the toe is covering the front.
And I'll start with the thigh. Also, when I start effleuraging and applying product, I always start with my target zone first. It's a personal choice. I don't know why, I just do. I guess because much of the time I don't need to work the whole leg. Now there's a lot of therapeutic stuff we can do, like with the heel of a hand, some of the hamstring attachments we can get to. I'm always going to be thinking about what's happening with the knee, so I'm always going to kind of get in there. How's that pressure?
Feels good.
Where are we at on that 1 to 5?
You're at a 3. Okay.
What would be ideal? Okay, tell me when I'm there.
You're there.
Okay. Quick and easy pressure checks. Do you guys ever find, so do most of you use a 1 to 10 scale for pressure checks?
That's standard, I think, for a lot of therapists.
It's usually what we're taught in school.
I like the 1 to 5 though.
Steal it, it's all yours. I just kind of over time realized those whole numbers, you know, your client's brain is not here, hopefully, when we're massaging, right? Hopefully we want them in a theta state, that daydreamy flow state. And so if you ask them a question, you don't want them to have to travel from the Bahamas to Seattle to generate a response. Make it easy. And I love it too, because my clients who've been seeing me for a while, they're just like, that's a 4. I want you at a 3.3. Like they just adapt to your, and then it's like kind of like an inside thing. And then down here, I would do some nice lovely zhuzh and effleurage. And the great thing about the leg here is you can really kind of get the tibialis anterior, some of the other things. Yeah, if you need to reposition a body part, no big deal. But that's basically it. And then some of the massage myths have to do with reflex points around the ankles. Anybody need a recap as to why this is a myth?
Go ahead and cover it.
Alrighty. Well, reflexology and foot massage are different. And we're not doing reflexology. We're just getting in there mechanically and working out the foot. I would not apply direct pressure points, even if somebody asks you for labor induction. I mean, I guess you can. Again, think about liability waivers if you want to, but I mean, have you guys ever heard of somebody inducing labor with reflexology?
But I've had
My friend has doing this.
I had a therapist I worked with.
Doing one here?
The one right here.
Okay. I thought this one was for headaches.
No, I don't know.
Yeah.
I think it is this.
Oh.
I don't know.
Yeah.
One of those.
I say if the mom comes in, she's like, help me go into labor. I'm like, oh, I'm gonna bust out some tricks and see if we can help you. You know.
Yep.
I think it's
And
very vague, so it doesn't
Yeah.
always
Yeah.
work.
there, and because it's like 3,000 plus years old, it's
That's
ancient
right. It
traditional
is.
Chinese medicine.
Yeah.
There's not a lot of documents usually.
No.
It's like this
Like, oh.
folk. I don't call it folk. I don't mean
Folk
to be
lifestyle.
disrespectful.
Oh, lifestyle. No, it is.
It's just different than a Western approach, right? So, and I think it's always wise to be, inclusive and not dismissive of other belief systems, but it's also a good opportunity to educate your client because you will get that question. And so if you know how to answer it, you look like a leader, don't you? And that's what we want. So this is basically how I would finish a 60. Some important spots to hit. Let's see, where's my cheat sheet? Thank you. Okay.
Yeah, a lot of these. Can I ask you why you choose the side you use the left side?
Yeah, do you remember when we were saying earlier with the laying on the left, the liver and the inferior cava, the blood flow? There's also some mesenteric arteries in here. There's just a lot of blood flow that we want to keep free. I would also always do side lying on the left if mama has multiples, high blood pressure, preeclampsia, but also talk to mom. Like, she's been living in her body 24/7, so if she's got preeclampsia, it's not a black or white thing. Do y'all know what geriatric pregnancies are? Have you ever heard this term?
36.
What's the age cutoff for
36, 35.
I think it's 35.
35.
So if you're
I do after
35,
35.
you're pregnant.
Geriatric.
No,
Yes.
I'm not.
No,
but if you have a smart doctor, they won't. And they don't.
But all of this to say that a lot of what mamas are receiving, if they're going through the traditional medical route and they're having an in-hospital birth, etc., they're being put through the system that is going to try to label and sort of pathologize them, like put them in a box
Try and say you're high risk just because
as part of
you're
their treatment plan. So, but again, this mama's probably not living in a black or white kind of state. It's probably somewhere in the gray zone.
I have a question.
Yes, ma'am.
Aromatherapy.
Yes.
Is that okay?
Absolutely.
Okay. In school we were taught absolutely nothing.
Ask them.
Oh.
Because
No.
a lot of women
So-
are sensitive to scents. It's really
Yeah.
what it is. So you ask them, and that it's okay.
Well,
it's not,
no, hang on.
But nothing's
I do have some info.
nothing's induced or
It's not black or white, so technically, we had a question about essential oils. Technically, there is a class of essential oils called emmenagogues, and you should look them up. Rosemary's one of them. There's a whole bunch, but those are essential oils that probably should not be used. They promote menstruation.
Yeah.
That's what makes them emmenagogues. Not all essential oils, though. Okay, peppermint is one that I use commonly. But the way that I use them in practice, guys, it's trace. It's mostly inhalation. I don't apply topically unless I've got mama's consent. And usually when I'm applying peppermint or cryoderm, it's for nursing neck. It's usually postpartum. But sometimes it's during pregnancy, and sometimes it's just like a spot of biofreeze on the sacrum. Very targeted, but tiny. So again, it's not a yes or no, it's a how. But make sure you Google emmenagogues. It's EMMENAGOGS.
Somebody asked us for oils for receiving.
So with the essential oils,
Sorry, I was writing.
I'm sorry.
Be careful with what.
There's no research really on it yet. Is the bottom line. We don't have
Did you write it down?
a clinical study that we
I
can
was
point
thinking about
to.
is we do like an add-on where we mix
I don't know.
essential oils and oil. Yeah, that's what I've.
And what kinds of essential oils would you typically use?
we have flavors for
Yeah.
which you, I mean,
They have like a
There's
they have
rosemary,
I don't
lemongrass,
understand
but they can choose what they want out of
So
the box
clary
up front.
sage is another emmenagogue. So just do your research. Lavender is totally fine.
Yeah.
Use lavender.
So we would have to like
Eucalyptus and lavender are my top two.
absolutely know a list back there.
Just
Yeah.
give them
Honestly,
the
just
options of the
Google
ones
a
that are
Menegogs. Did somebody write down that word?
I think
Can you spell it again? Yes, EMMENAGOGUES. I was writing it on the ceiling as I'm a visual. Yeah. Menegogs. Are you ready to be repositioned, or do you want us to work some of the? Okay.
Well, you need to, whatever you need to do is fine.
One of the
Yeah.
things, can you show if they've got like the sciatic and if they really want like loose
Yes.
hip
Yes.
space?
Thank you. So I definitely wanted to show you all the SCM, or not SCM, the QL. Yes. You might have my tuchus in your face. Okay, so there's quite a lot that we can do here. I tend to work over the sheet for a lot of glute work, you guys. Anybody else okay working through the sheet for glute work?
I usually do.
For hip work. So, if I was going to work more of the like glute med, for example, I might have just draped up a little higher and made room for my hands to do it. But quite frankly, most of the time when I work low back, glutes, and hips, I'm working this way instead of this way. Can anybody imagine why this might be a better angle?
because that's the way the origins and insertions go.
That's a good thought. I'm mostly
Blood
thinking
flow.
about postural corrections. And APT is
Raises
so
the hips,
common
and you wanna push them
that
back
you
down.
want to reverse that, right? So anytime I'm working glute work, this tends to be home base where I'm at right now. And I'll come in. I tend to work big tool to little tool. So I'll usually start off, you guys saw me palpating and kind of doing some lovely work with my hands. But I will also palpate with my hands, find a spot, and then target it. Okay? Now, since I'm targeting and I'm sort of pushing this way but also that way, I'm going to stabilize for counter pressure. Does that make sense, you guys? Can you all see? Okay. And then just set, sink, and then apply your stroke. And how's that pressure? Where am I at?
Feels good. You're that's the airport.
And it's kind of ideal pressure where I'm at.
Yeah.
Do you guys remember the movie Contact from 1993 or whatever? Jodie Foster. Small moves, Ellie. Small moves. So when you're working this whole region, it's just
That was a good movie.
right, but it's just glacial pace and just the tiniest little corrections as some of these things release and travel, release and travel.
Are you ready, Linda?
I think I'm gonna keep it there. I think there's more advanced stuff I could do, but I want to wait till our breakouts, I think, to gauge where your team is at before
Yeah,
I
you can get
throw them in the deep end.
more advanced stuff.
Because I was gonna say this lower leg, if it's flat, we can get in there and work the obturators. There's a lot of deep work you can do in sideline. I prefer prone for it. It's just the best. But you can absolutely do some beautiful high value work in sideline. Also with the belly, when you drape for the back, which again, there's a million ways to do it. I just kind of tend to tuck under the tuchus and then roll. And the blanket that I use is kind of grippy, which I like. It's almost like a hospital blanket. It's that grippy. But then, yeah, basic draping, right? You guys have all seen this a million times before. I like to do both sides of the back when I do it. Let me get my product. Does anybody have a preference when you're doing sideline, if you do one side or both sides?
I do both.
I'll start with the upper side and then work and then do both. Like
You do one like half at a time?
Because I kind of mimic what I do for my regular clients, and so I'll work on one side and then work on the other, and then incorporate both together, do the symmetry stuff. But
Nice.
it's just a matter of taste,
Yeah. It's your personal style.
pretty much.
I like it. Yeah, I honestly try to replicate as best I can what I call a non-natal massage.
Right.
And
That's
symmetry, so I'll try to use that.
It also gives them a little taste of what it's like to not be pregnant.
And the whole dermatome would be craving touch anyway, so.
Can I feel that lotion? Oh no. See it gliding.
It's a paraffin base, but when you warm it up, it gets nice and glidey.
It's all about the
Now, this
whatever lotion
product
has.
for neck and face, I will usually ask. For face massage, I have a different product I'll use. But yeah. Lovely masseter, temporalis, jaw, lots of stuff you can do here. And any beautiful moves that you guys might already have in your arsenal for sideline, you can probably still use those, just adapt them around everything your client has going on. But yeah, you just kind of keep jamming. The QL though is the big one. So we all know where the QL lives, yes? No refresh needed on that. Okay, I'm sorry, I'm gonna be in your way again. So generally speaking, I like to do a compression to kind of stabilize before I glide in. To the QL. Where's that pressure at?
You said that like a 2, I would say.
What do you want it?
You can get up to
Tell me when I'm there.
Are you applying a lot of pressure?
it's deep. Yeah, that's good.
She just did her double and asked her, and then increased it.
So her initial feedback was a 2.
But you went in there pretty deep.
It feels like deep work though.
So as a quick refresh, you guys all said you know where the QL lives, but I just want to remind, these are the erectors, the trunk of the tree muscles as I call them. QL is under that, it's deep to that, but guess what else is deep to that? The baby. So we have to be super targeted. So because I know it's like right there, you can use your fingers to get it or to at least palpate it, but then you're gonna want a big tool for a big job. It's another one of my practice principles, pick the right tool for the right job. So you can find, with your palpation pause, but then using that kind of pulsing, that dynamic compression, just kind of hang out. And then again, keeping in mind the other principle that the body can only handle so much change at a time. With prenatal clients especially, we want to be mindful of those invisible boundaries of like how much is too much, and like even just working a targeted area, how much change do I want to affect at a time, right? Not just the session, but like this, and then the whole thing, and then larger treatment planning. So for this, empathizing, feeling like, okay, she's telling me it's deep, she's telling me I'm at good pressure, I'm gonna hang out until I feel enough of a release. And that's just kind of the art of it, less the science of it, you know, it's less rigid. But does that kind of make sense with all y'all? Okay. And a lot of what I'm describing, doesn't it sound familiar, more or less? Because it's kind of like just Gen Pop stuff, but translated for a special topic. I'm not showing you anything you haven't ever seen before, right? But like, it's just how we do it. Okay, so imagine I'm like done my whole back routine, and then I would simply cover her back up. Is everybody feeling ready to break out and start the next phase of it?
Wait, you say you're gonna do some stretches around when you lay down or something. I don't see no stretches aside from the pushing it on the sacrum.
So a lot of the stretches I do are when I have her supine or prone
Okay.
for symmetry. I like to,
Okay.
anytime I'm stretching, I really like to sort of file that under balancing work. So sometimes I'll even only do one side. So I don't do a ton of stretching when I'm doing sideline work,
Okay.
just to be frank.
Okay.
I might mobilize the arm at the shoulder a little bit, but it's really minimal. Usually, and just again to more on that, when I put a mama in side lying most of the time, it's because we have to utilize side lying. So it's already a situation where stretching might not be appropriate.
And right now here, we do all our mama sideline.
Yeah, and that's wonderful. That's great. You can still do all the things. And that's also why I wanted to start by demoing Chrissy in that semi-reclined position to show you guys you can do some stretching from that position. You can do lovely things with the neck, lovely things with the arms. Oh my God, this would feel so good. Like nursing, just all of these wonderful things you can do from that symmetry. But then the sideline, you're not going to be able to assess quite the same way. Does that make sense?
Because I stretch the hips up, that's why.
Hmm?
Because I stretch the hips, that's what I asked.
Do you want to show me?
They know their own thing. Because all I do is Asian techniques, that's why I asked you, but then I just something different.
You should show in your breakout.
You know what?
When you do your breakout, you should show.
Do you do a lot of Thai type stretching?
Similar, but it's, I'm certified with Shiatsu, so I do the stretches as well. But in the legs, I use a little bit like, I just lift up the legs, but then it's the hips, that's what I do. I just don't want to